Hello, ladies and gentlemen, Medicare beneficiaries of all ages and good stuff. My name's Johnny Brock. I'm your host. I'm back for another episode, and today we've got some a little information for you. Medicare Savings Program. So today's episode is about Medicare Savings Program, which if that fits if that's obviously you clicked on this video because you're interested in it. Medicare Savings Program is there's a few different levels we're going to discuss. I'm just going to go over the levels with you. The income is based off of the state that you're in. It's different in every single state. So, I could look up Mississippi, I could look up North Carolina, Texas. They're all going to be different. I'm just going to kind of tell you exactly how it works as far as the financial aspect of it is concerned. It's based off of your income. So, let's say in Mississippi, it might be that if you're under $1,500 a month, you qualify for QMB plus. If you're over 1,500, or if you're married, you might be under 2,000, you might qualify for a certain level. It just depends on whether you're married, whether you're single, and it depends on how much money you make. I could do separate videos at another time about specific states and the requirements. However, those requirements fluctuate year after year. So that will change, so if I make a video about that, it's going to change. Now, one thing that's kind of not going to change, at least we don't foresee it changing anytime soon, is the programs, these Medicare savings programs. They have different Medicare savings programs, and it's basically levels, and it depends on your income. So what we're going to go over is we're going to go over those levels. So thanks for joining in. I'm super excited to go over this with you, and I hope you're having an absolutely fantastic day. And if not, or if so, I hope this continues to bring you joy and information that you need. So we're going to share the screen of a little chart here. This is the chart that you actually can find this in a summary of benefits for what's called a dual special needs plan. So it has all the levels of the Medicare Savings Program in it, because this particular plan, any level qualifies that particular client for it. So first, we're actually going to start at the bottom here, because that is the lowest level. And basically, it just goes up. So the from the bottom up, the farther you go up, the more it covers. Okay. So we're going to kind of dive into it a little bit. And I'm actually going to use what's called Chat GPT. If you don't know what Chat GPT is, it is a pretty great tool that you can search the entire internet, and it gives you everything you need to know. It's artificial intelligence. It's extremely helpful. So we're going to go over qualifying individual program first. So what does it cover? It covers the Part B premium only. So unlike QMB or QMB Plus, it does not cover deductibles, co-insurance, or co-payments. So obviously, those higher levels will cover deductibles, they'll cover co-insurances, they'll cover co-payments, whereas this level is just covering those premiums for you. So, this level will probably be like, if you're married, two income household, you might have to be, $2,000, between $1,700 and $2,000, and you probably qualify for this. I'm just guesstimating there. But it saves you from having to pay your Part B premium and have it deducted from your Social Security check. So that is the QI level. It's the lowest level of the Medicare Savings Program. So it says here who qualifies. Typically 120 to 130% of the federal poverty level. And that would be, it says here, states may set limits, like I said, but they're usually similar to other Medicare savings programs. Around $9,000 for an individual, $14,000 for a couple, varies slightly by state. Must already have or be eligible for Medicare Part A. So there you have it, $9,000 for an individual, $14,000 for a couple. So that would be roughly, if you do the math, you're probably looking under $1,500 a month. The $1,500 would be $16,000 a year. So about but under $1,500 a month is going to qualify you if you're a couple, and under $1,000 a month to be around probably $750, $800 a month is going to qualify you. Now, here's the thing. If you're making $700 a month, you actually qualify for a significantly higher level than that. So first come, first serve. Funding for QI is capped annually by Congress. States must process applications in order received so it can fill up. So that might be a reason that people get denied when they feel like they shouldn't. Reapply every year, unlike QMB or SLMB. Enrollment in QI is not continuous. So that's why some of my clients who are higher level of Medicaid don't have to worry about anything, and the ones who are lower level, they do, because it's not renewing automatically. Beneficiaries must reapply annually. No dual enrollment with other MSPs. If you qualify for QMB or SLMB, you can't also be in QI. So it's kind of like, you can't have a Medicare Advantage plan and a drug plan. You can't have you're either in one or you're in the other. It's independent. So why it exists, it's created as a part of the Balanced Budget Act of 1997 to give extra help to low-income Medicare beneficiaries who can't fit into QMB or SLMB. It's a good thing. It's a good thing. QI, basically, in short, Part B premium help for people with incomes between 120 to 135% of the federal poverty level. All right, so let's move on back to the summary here, the chart. So we're going to move on to the qualified, disabled, and working individual. Okay, so this is pretty obvious what this is. This is for people who are disabled, but let's let ChatGPT give us a little bit more information on it. All right, so we're going to break down the QDWI program. Qualified, disabled, and working individual. Pays for the Medicare Part A premium. The reason it does that is because if someone is on disability Medicare, then Part A, they may not have the full quarters yet, right? So they may not qualify for premium-free Part A. Some people lose free Part A if they return to work after receiving disability benefits. So if you're on this one could go away when you get back to working, right? So say you're disabled for 6 years. That means you typically, I've seen it happen quite a few times. Usually when you're on disability for 24 months, on the 25th month, you get Medicare. So after you've had the disability for, let's say, 6 years and you go back to work, they're going to end that Medicare and it's going to end, and then you're going to pick it back up when you turn 65. You have to be under 65 years old, disabled, lost premium-free Part A because you returned to work, okay? So still eligible for Medicare Part A, but must pay the premium unless QDWI helps. Income limit, usually 200%, less than 200% of the federal poverty level. Resource limits generally around $4,000 for an individual and $6,000 for a couple. Resource limits, that means that you can't have more than that amount in the bank, which is probably, for QI, probably what that meant as well. Assets, yeah, 9,000. This isn't income, this is assets, which is pretty cool. So, in short, QDWI, Medicare Part A premium help for working disabled individuals. So it means that you still qualify for Medicare. So I was wrong about that. It means that you still qualify for Medicare. However, Medicare Part A premium needs to be helped because you continue working. So you don't qualify for premium-free Part A anymore. Now, let's go back to the chart. So QDWI, that's for people that are on disability. All right, so full benefit dual eligible. This is pretty simple. This is for the people that are highest level. It covers everything, all the way to the co-pays, and you do not pay a dime. The only thing you might pay for is, if you're FBDE, is you might pay a little bit for medications. Let's talk about FBDE a little bit here and get a little bit more information on it. Go. So for full benefit dual eligible, let's dig a little bit into it here. All regular Medicaid benefits for your state: doctor visits, hospital care, long-term services, nursing home, or home community-based care. I mean, that's amazing. So like a lot of people are wondering about nursing home. The only way people can really get it is if they get full Medicaid. Otherwise, that's the only time that people don't need home health policies that we offer is when they have full Medicaid, which a lot of people will have just QMB, and they'll think, oh, well, should I have this policy? Yes, you should, because you don't have full Medicaid. You're not going to have the nursing home covered. You're not going to have home, they're not gonna pay for somebody to come in and wipe your rear end or give you a bath. Let's see here. It says optional benefits, varies by state. The Medicare Advantage Dual Special Needs Program would be the best benefit if your state doesn't offer it here, which is very uncommon, really. Medicare cost help, Part B premiums, deductibles, co-insurance. In short, it pays everything. Full Medicaid benefits plus help with premiums and cost sharing. It's the most robust coverage tier. So that's good. All right, let's get back to the chart here. We have what's called SLMB, Specified Low Medicaid Beneficiary. We're going to do a little bit more information on this. So Specified Low Medicare Beneficiary, SLMB Plus, everything under SLMB. What does it cover? Everything under SLMB, so pays the Part B premium plus full Medicaid benefits. So it's basically adding two different program tiers into one. And it looks here 100 to 120% of the federal poverty level. So they had to kind of include, they didn't have anywhere to put this, so they just made a new section probably. Prescription coverage help, doctor visits, hospital care, long-term services, optional extras like dental, vision, hearing varies by state. You're going to want to use a dual special needs plan for that. Who qualifies must have Medicare Part A and B, income 100 to 120% of FPL, must also meet your state's criteria for full Medicaid eligibility, income and resources. Dual eligible status, individuals are full duals, meaning they're considered full benefit dual eligible. Wow, that's cool. So if you're SLMB plus, you're still considered a FBDE. Often grouped together with QMB plus, both are plus programs because they combine premium assistance with full Medicaid benefits. Extra help with Part D, automatically eligible for low-income subsidy on prescription drugs. Why it exists, bridges the gap for people who qualify for Medicare plus Medicaid, but whose income falls just above the QMB range. Ensures that individuals get comprehensive coverage. All the gaps in Medicare, Medicaid, and Part B premium, and Part A premium. If you have that, you're not paying the Part A premium. But Part A premium is free. So if you didn't have free Part A premium, they'd probably have you in a different level covering it. All right, so in short, SLMB plus equals SLMB plus full Medicaid benefits. It's essentially a full dual eligible status for people with incomes 100 to 120% of FPL. All right, fantastic. So let's go back to the chart here. The next one, specified low-income Medicare beneficiary. It goes by income, guys. So we started at 170%, right? Now we're going all the way down. So the higher we go, the less money the person has. All right, so SLMB. So we had SLMB plus. Now we've got SLMB. Let's take a look at what it says about that. SLMB is really just going to have Part B premiums covered, probably maybe a few other little things. Let's see. Specified low-income Medicare beneficiary, what it covers, Part B premium only. Look at that. Does not cover deductibles, does not cover co-payments or co-insurance. And it's going to have extra help for drugs, too. Anybody who has that is going to have extra help for drugs. I'm surprised it's not saying anything about that. But I know that for a fact. If you have SLMB, you have extra help. LIS. LIS is a prerequisite for all of these. The lowest level is LIS, and that's not Medicaid. You have LIS first. So I could even ask this. This is what I love about ChatGPT. It's so cool. Watch. Does SLMB have LIS for drugs? Yes. Yeah. So anybody who qualifies for any of these is going to have LIS automatically added in. All right. So the next one is QMB plus. So we're going to talk about QMB plus first. QMB plus is clean, detailed breakdown of QMB plus. So what it covers, everything under QMB. Medicare Part A and B premiums, Medicare deductibles, Medicare coinsurance and copayments, plus full Medicaid benefits, which can include long-term care services, prescription drugs, optional benefits like dental, vision, hearing, transport. It's always going to be done through a dual eligible plan. I've never seen a case where the state offered that stuff. Who qualifies must have Medicare A and B, typically less than 100% of the federal poverty level. Must also meet your state's requirements for full Medicaid eligibility. Dual status, QMB plus, individuals are both QMB, and full benefit dual eligible. No Medicare cost sharing. They cannot bill a QMB plus beneficiary. Providers cannot bill you. That's the one thing about Medicaid. If you have full Medicaid, QMB plus, even FBDE, QMB, SLMB plus, I think, you cannot bill that person. They have to send that bill to Medicaid. Medicaid will cover it. Whether you have Medicare or Medicare Advantage, your Medicaid will cover your costs. Why it exists: provides the most comprehensive safety net for the lowest income Medicare beneficiaries. QMB plus equals QMB, premiums plus cost sharing plus full Medicaid benefits. Wow. All right. Lastly, last one, QMB, qualified Medicare beneficiary. Let's see what chat has to say about this one. Yep. QMB, what it helps pay: Medicare Part A premiums if you owe anything, Medicare Part B premiums, Medicare deductibles, co-insurance, and co-payments. So it doesn't cover nursing home and in-home care. So that would be somebody who has QMB would need a home health program. QMB equals Part A and B premiums, deductibles, co-insurance, co-payments, protects against balanced billing. So that's good. Balanced billing, provider billing protection. Doctors and other providers cannot bill QMB beneficiaries for Medicare covered services. If they try, the bill must be written off. Wow. Look at there. Look at that. I'm sorry, I wasn't sharing my screen on that. So what it says here is it helps pay the Part A premium, Part B premium, Medicare deductibles, Medicare co-insurance, and co-payments. Who qualifies must be entitled for Part A, less than 100%. Resource limits 9,000 to 14,000, depending on if you're single or in a marriage. Provider billing protection and automatic LIS. And in short, Part A and B premiums are paid, deductibles, co-insurance, and co-payments, and protects against balanced billing. So if you have QMB, you do not have nursing home or home health aid coverage. So keep that in mind. It's a good program, good policy to get to home health policy if you have QMB. If you don't have FBDE or one of the pluses, you should get a home health policy. All right. So we're going to stop sharing. And I will tell you this, obviously, anytime you have questions, you should put them in the comments section because, it's very important that beneficiaries are engaging with us so that we can make more videos for you. We can even do a short with a quote in it and answering the questions for you and tag you in it just so you get that. So keep in mind, in the description, you have my contact information. And if you need anything at all, please don't hesitate to reach out. I appreciate you so much for joining in. Thank you for joining in on this 18-minute lesson on Medicare Savings Program. My name is Johnny Brock. I'm signing off, and I hope you have an absolutely fantastic day. God bless the USA. God bless you, and God bless the Medicare program that we rely on. Thank you so much for joining. Bye-bye.